Hi everyone. So we are here with the SPC counsellors in Emily and Nathan, along with a Year 10 student in Jake Cutajar. My name's Connor Brown, and today we're going to discuss basically the psychology around mental health and things that you should be aware of, following Are You OK Week in the end of term 3 and World Mental Health Day today on Thursday, the 8th of October. So I'm going to hand it over to Nathan to speak about COVID and this tough period that we've been through and give a brief little introduction.
Yeah, thanks for that, Connor, and thanks for having us. It is a really important topic. Psychology and mental health is always important, but we've had it harder than ever, obviously, this year. And it's been really tough, particularly on young people. It's very natural for teenagers and everyone in high school to start branching away from family and start leaving the family home and exploring their own identity. And what COVID's forced us to do anyway in Melbourne, Australia, is to keep us all indoors and bring us back with family. We know we talk to a lot of the senior boys and that you're missing a lot of the big events for the year, and it's really upsetting. And what we're starting to see, while there's no hard data on it yet, that the rates of people seeking out psychologists, GP visits, hospital visits are really starting to rise. So it's really important we talk about it, spread awareness, get the message out there about some basic facts and seeking that help.
So I just want to sort of get your view on a couple questions around, the mental health aspect of things. So I'm just going to jump straight into it. Like, mental health is a phrase that people can tend to use in the wrong manner, not really understanding it, and it's created a sort of stigma around it. So could you please explain what mental health really means?
Yeah, absolutely. Look, there's a large range of definitions, I guess. The one we tend to use is the World Health Organization, and that's basically mental health is a state of well-being. And when we're able to deal with daily struggles or stresses, we're able to contribute to school, to family, to community, your mental health's going okay. What the danger is there's sort of this imaginary line. It doesn't, in essence, exist. It's different for everyone. But when your daily life starts to be impacted by your thoughts and your behaviors, that's when we need to be really careful. So if you imagine a line, sort of a spectrum, on those days or over long periods of time when you can't deal with daily life or going to school, that's when it's really important. And we know that something with mental health isn't going that great.
And so, as I mentioned just in the previous question, it's created that sort of stigma, which leaves people reluctant to sort of open up and be vulnerable to deal with their matters. So, can you sort of give us a few tips into how to remove this stigma?
Yeah, absolutely. So the best way is just by talking about mental health, as you guys are now. We really want to normalize that conversation and seeking help, because we know that 1 in 4 people experiences a mental illness in their lifetime, and that doesn't even include normal stress like school study stress, breakups, lockdown. So seeing a psych or a counsellor should really just be the same as seeing a PT, physio, doctor, just another way to keep healthy. So things we can kind of all do are to check in with our mates, make it part of the normal conversation, and support them when they reach out, because it takes a lot more courage to put up your hand and ask for help than to bury your head in the sand.
So, just on that, do you recommend, people sort of opening up to their friends to sort of create that chain effect of people wanting to actually speak about what's going wrong? Because I think it starts with, one person. Otherwise, people are going to be reluctant.
Yeah, that's it. So I've got students all the time coming and saying, like, we just don't really talk about that, in our mates. We just joke around all the time. We just have a laugh. So it just takes one person, as you said, Connor, to just kind of say, hey guys, it's kind of important that we check in. How's everyone going?
Yeah.
Or, I'm having a tough day or whatever it is. So exactly, just one person can make all the difference.
Can I just ask, where do you think that stigma comes from? That stigma of mental health being like hard to talk about?
Yeah, that's a really good question. And Nathan, I'll open this up to you as well. I think it's just a historical thing. In the past, mental illness has been seen as being crazy, hearing voices, all of that kind of really negative associations. So then, it's really hard to bring it to just being a normal part of everyday life.
Yeah, absolutely. And I think one of the traps with mental health is even Hollywood and movies really exaggerate those big things. When people think of mental health, they think of someone that's quite angry on the streets, abusing people, walking around, or maybe taking drugs or drinking or something like that. When in reality, 90% of mental health is below the surface, and it's really hard to see. So if we could write a letter to Hollywood to stop exaggerating mental health symptoms and glorifying it, that would be great as well.
So recently, through my studies in psychology, but also a TED talk that I've seen that Jake sent me, it talks about, the importance of sleep on health in general, and it can have like multiple effects. But people tend not to get, the recommended sleep of 8.5 hours for adolescents, going through high school. So can you please speak on the sort of importance of sleep and the benefits of it?
Yeah, that's it, Connor. If I've probably talked to you boys a few times about it, but sleep is just the number one activity we should do to look after our mental health. So when you think about it, we sleep for about a third of our lives, and I refer often back to elite sports people. So guys like Elliot Kipchoge, who recently broke the 2 hours in the marathon, and Roger Federer, they make sure they get 10, 11 hours sleep a day. That's how significant it is to get the body to recover and to overcome stresses. Now, that can be physical, that can also be mental stresses. The science suggests when sleeping, the body gets fixed from damage, memory, learning is consolidated. So it's a real trap, especially for the VCE kids. So you're getting your mind, you must be doing hours and hours of study a day, but actually what's more effective is quality sleep. And that's what we really encourage. And if you do a bit of Googling and look up some of the extreme studies, that people go for records of how long not to sleep. And I don't recommend doing this at all, but at the end of the day, they start hallucinating within 24 hours. I think intelligence tests are lower, physical activity is lower. So if there's one thing you can take away for looking after yourself, quality sleep's the one.
Can I just ask as well, how can we better structure our lives to accommodate for like getting the required amount of sleep, like the recommended amount of sleep to make sure we're at optimum health?
Yeah, it's really about prioritizing. We sort of live in this 24-hour world with mobile phones and news at our fingertips, and at work we're encouraged to work long hours at some places. That's slowly being overturned. It's slowly being overturned into, say, 4 working days a week. Some countries across the world, I don't think secondary school students start till 10 a.m. And that really fits in with the teenage body clock as well. So we need to make it a priority and structure and change the way that we function every day.
So I don't want to like scare anyone that's listening to this, but there's studies that have shown the effects on the immune system by not getting any sleep, and
Yeah.
and also with the daylight savings changes. So there was an experiment that was run that every year, look at the effects after daylight savings, and when people, lose that hour of sleep through daylight savings, the increase in heart attacks raises by 24%, I think. So,
Wow.
I mean, it's pretty drastic. So, along with, your own mental health, sleep also has the benefit of sort of your own body replenishing itself and being able to, fight off diseases. Is It's so beneficial towards, diseases we may see in the elderly, such as Alzheimer's. It has all those sort of effects to, you know, sort of counteract that. So I think it's really important to consider your sleeping pattern. Um, of course, as adolescents, we tend to have, that delay of sort of the melatonin release, which means that we go to sleep basically 2 hours later than everyone else. So it's important to consider what time you're going to bed and what time you're waking up, create that sort of consistency. So many people, experience bad days and would consider this like, would you consider this normal? And how would you recommend people deal with a common struggle of a bad day?
Yeah, it's a really good question that I think applies to everyone, especially at the moment. So I think it is normal and we all experience bad days for sure. I think lockdowns made that really, really clear. In terms of how to manage it, it's really just working out what works for you. So it might be taking it easy and having a night of study, cleaning your space, going for a walk, getting active, talking to a mate, playing games, listening to music, whatever works for you. And then just prioritizing that self-care instead of just trying to push through. Because usually, the odd bad day is just your brain telling you you're tired and you need a break. At the same time, I guess if you're feeling off for like a week or more, or people around you have noticed a bit of a pattern, that's when it's probably less normal and it's probably a good time to reach out to someone.
So just on that, people in especially lockdown for studies, they might feel overwhelmed with classwork but they know they have something due the next day or a test coming up. And if you're feeling bombarded and have that sort of bad feeling, do you still recommend taking time, or is there other ways where you can prioritize time for work and time for rest?
Yeah, look, I think that prioritizing is really good, especially at the start. But when you're in that state where you're feeling overwhelmed, and Nathan and I hear it a fair bit, your brain's working overtime, it's not processing information properly. So the more you push yourself to try and study when you know you're feeling stressed out, the less your brain's going to cooperate. So when you're in that real bad moment, it's a good time just to take even an hour or two and just say, I'm going to reset, I'm going to have some deep breaths, I'm going to do a meditation, whatever, go for a walk. There's no real benefit to pushing through in the moment. But yeah, absolutely, getting that work-life balance right, getting that daily structure, that's all going to stop you feeling overwhelmed in the first place.
So for people who are unaware of the mental health disorders out there in the world, because there are many, 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 the list goes on, are you able to explain some of the common signs that people can identify in their friend if they're struggling, or, if they need to reach out for help, as you mentioned, that sort of line of where people sit at?
Yeah, absolutely. Connor, have you learnt about the DSM yet? That sort of Bible
Yes.
of mental health. Yeah.
Yeah.
Have you seen it?
Yeah.
Yeah.
It's quite long. Yeah.
Yeah. So there's a big, thick book of all these mental health difficulties in the world, and they've changed. They've changed over the years, and it gets restructured every 10 years or so, and sometimes they're included for political reasons even. So it can be quite controversial. For the individual, they vary and they change according to who's who. And often we're really good at picking up signs after someone might have had a really difficult time, maybe after a panic attack or been really angry. It's quite easy to pick the signs, but in the moment it's difficult. So if you're looking at your mate in the playground or at home and you're thinking, oh, they've had a bit of a change in personality, a loss of interest in things that they usually like, that they look a bit tired, or they're talking about a real lack of sleep. They used to be really on time, but now they're arriving late, becoming angry or avoidant, or they might stop attending school, things like that. These are often just little signs, and you can never diagnose a mental disorder just off one thing, but over time you can develop a bit of a picture. So if you're able to identify those things and sort of put them in a bit of an order, that picture becomes clearer.
So is it mainly, as you're speaking, those common things, but the effect on someone's, daily functioning and being able to function independently? Is that sort of what you're indicating at?
Yeah, that's it. So you can have poor sleep and be really stressed, but still manage to get to school and still do your work for a period of time. But you've probably experienced this year, Connor, sometimes it gets to a point where you're just so burnt out you can't attend school. And that's where it's a bit more of a clue that might be something deeper going on.
So for those who struggle to reach out, what would you suggest they do, or what steps they take?
Yeah, so it can be completely daunting, and lots of people have never seen a psycho counsellor before, so it can seem like a really big deal. So kind of our advice would be to find someone you do trust and connect with, whether it's a parent or a teacher that you really like or a mate, and just start the conversation. It can be really small, just like, oh, I haven't felt like myself lately, or I don't have any energy at the moment. Some people might find that sending a text message or an email is easier than face-to-face. And then whoever you feel comfortable with can talk you through the next steps. It's just easier to have someone go through it with you. And often just opening up can be a huge relief in itself. And just on the flip side, we often get peer referrals from students who are worried about a friend. So if you're in that position, maybe someone's opened up to you or sent you a message or whatever it is, you can always get in touch with us and we can be really discreet about it too.
Can I just say, I know people who don't really like the idea of psychologists or counselors because, like, it's kind of like this preconceived notion of, oh, they're paid to care about you. They don't genuinely care about you, you know. What would you say to address that kind of idea?
I really find that there's a certain personality that fall into psychology, and probably similar with medicine and nursing. It's a very generally caring personality that gets there. And I often say to boys that too come through, some often feel stressed because all their friends go to them about problems or try to get their help. That's the first little sign in high school. You might fall into this field because you're naturally trustworthy and people want you to listen.
And so, you know, there's a difference between being sad and being depressed. However, people use the phrase depressed in the wrong manner.
Yeah, good one. I guess this comes under some other things. You boys probably know some terms that, someone says, oh, you're so OCD, or, that's so, the weather's bipolar, I think. And that really minimizes like significant mental health problems. Sadness is just a part of the human condition. So we need sadness. It's one of our core emotions. And for anyone that's seen the movie Inside Out, you can't be happy if you don't know what sadness is. And sadness is okay in small doses and we can learn from it. If there's the death of a family member or of a friend, we go into sadness or mourning. That says the body's processing something. Upset about a friend being mean to us, that says something about that learning experience or relationship breakup. So depression includes sadness, but it's also a lot of other things. Again, sort of sleep difficulties, a loss of interest in everyday activities, constant negative thoughts. And officially, a depression diagnosis has to go, you have to experience these things for about 2 weeks or more. So one thing is within that normal range of functioning. But again, over time, if those things stick around, that's when it becomes that mental health problem. Yeah.
So back to the idea of using words in the wrong phrase and the stigma, would you suggest, people think about what depressed really means and think about using it in the right manner rather than just throwing it around?
Absolutely, yeah. It's all about that mindful awareness of the use of your language and how that's impacting those around. So people will say it quite flippantly, but you don't know what's going on for the person next to you. So it is about that education and getting the word out there that it has very serious meaning.
So people can get nervous and some people can get anxious, and there's a difference between the two. But what would you consider the signs of anxiety are and when you need to reach out?
Yeah, absolutely. So we all get nervous and anxious sometimes, like before a test or a presentation. That's really, really normal. A degree of stress can actually help us perform better because it makes us more focused and it can motivate us. The line would be that getting in the way of normal life that we've talked about. So if you don't want to see your mates anymore because you're worried about saying or doing the wrong thing, or if you can't concentrate in class because your mind's just racing, or if your thoughts are keeping you awake at night and you can't get to sleep, or you're feeling sick and have a tight chest and a racing heart without really knowing why, that's when we'd say it's probably getting to the stage where you'd need to reach out and develop some strategies to manage it, because it's getting in the way of that normal life.
Yeah. So is there anything that you've sort of noticed through sports, like major sports stars or something, that they deal with this sort of thing?
Oh, absolutely, yeah. I think that you'll find, any sports star lining up to do a kick or take a goal shot, their heart's going to go racing. Their heart's completely in it. They're invested. They care about the outcome. And you'll see a lot of the time them kind of stop and use the techniques. Like they'll visualize them making the shot, or they'll take a deep breath and just try and center themselves in the moment. So yeah, absolutely, really relevant.
And apart from reaching out, what would you say are important things that people can do to look after themselves and stay as mentally healthy as possible?
Yeah, look, I think this is where self-care comes in, and self-care is really important, and it can be really personal and even silly to other people. Recently, I signed up to Instagram for the first time, and that was for work, and there was a whole new world. And I stumbled upon a lot of Instagram influencers, and all they talked about was self-care and mental health, and they were done in these big, grand gestures and talking about when you're feeling bad, you should do this or that. But the other side of the coin is if we do little bits of self-care every day, that helps ward off mental health difficulties. That they don't have to be big shows or big activities. So they're the little things. For some people, that's taking a bath. For some people, that's going for a walk. For some people, that's playing with the dog and just being a little bit social. For others, it is doing those big, like the yoga, the stretching, seeing a psychologist is self-care. But it's really whatever you want to define it, and you end up at the other side feeling better about it. There are some things, if you do them too much, like drinking too much coffee, that can be a good self-care strategy. But if you have 3 espressos, that has the negative effect by the afternoon. So you have to be wary of those things. Yeah.
So in terms of that, I spoke to Mr. Velato recently about the importance of diet. Can you speak on how diet is sort of important towards the mental health aspect?
Yeah, so Mr. Velato is very knowledgeable about these things. In the last decade, there's been a greater connection found in science between the gut and the brain, and they actually communicate with each other. So if you're eating Maccas and KFC every day, and some people are lucky that they feel fine, but eventually this bad bacteria builds up that sends messages to the brain that the body's not okay, and then the brain can get impacted. And likewise, it's the opposite. If you're really stressed and the brain identifies the stress, it sends stress signals to the gut and the body, telling them, hey, we're in trouble. So keeping up that regular, generally healthy diet. It doesn't have to be all the time. You can always have breaks and have that McDonald's, once a month, once a fortnight. Mr. Velato will kill me for saying that. But generally, moderation is best.
So I want to thank you both for taking the time out to speak to us today. I think it's a really important thing, especially after Mental Health Day that's just passed. But I want you to remember 3 things: speak up, remember the importance of self-care, and also looking out for others. They're all things that we can do at home and to take care of our mates, and especially during this lockdown period. So I want to thank Jake as well for joining us, and I want you to take this away and take something out of it. And remember to try get that 8.5 hours of sleep. Thanks, guys.
Thanks, Connor.
Thanks,
Jake.
Connor. Thanks, Jake.